Morning class, today we'll be having our discussion on behavioral therapy. I have already sent you our learning materials and I expect that you have already read them. We will be proceeding with our oral recitation for today. Okay, let's begin with what are examples of behavioral theories, Miss Cortezo?
Hello, sir. So, according to our reference, we have Ivan Pavlov for the classical conditioning, and for the operant conditioning, we have B.F. Skinner.
Okay, thank you for that. Can Miss Baldos explain to the class what is Ivan Pavlov's classical conditioning?
Pavlov's classical conditioning, in simpler terms, sir, would be in a situation where two stimuli are linked together to produce a new learned response in a person or animal. It is on Pavlov's findings that behavior can be changed through conditioning with external or environmental conditions or stimuli. Pavlov's experiment with dogs involved his observation that dogs naturally began to salivate, which is the response, or when they saw food or smelled the food, which is the stimulus.
Okay, that is correct. How about Skinner's operant conditioning, Miss Granada?
From what I understand, sir, Skinner's operant conditioning claims that people learn their behaviors from their history or past experiences, particularly those experiences that were repeatedly reinforced. Skinner described principles that form the basis for behavior techniques in use today. These behavioral principles of rewarding or reinforcing behaviors are used to help people change their behaviors in a therapy known as behavior modification.
Okay, that's good, Miss Granada. I see that you have had your readings. Miss Ilvinia, can you please elaborate what is behavior modification?
Sir, behavior modification is a process of changing patterns of human behavior over a gradual period of time using the various motivational techniques, mainly the positive or negative reinforcement.
Very good. Class, we must bear in mind that these theories are important for us to be guided in implementing the appropriate nursing care for our clients. We give positive reinforcement to the patients who have performed the desired health behavior so they associate the action with the reward and do it more often. Negative reinforcement involves removing a stimulus immediately after a behavior occurs so that behavior is more likely to occur again. And lastly, we have this method in behavioral therapy called systematic desensitization, which can be used to help clients overcome irrational fears and anxiety associated with phobias. Can anyone share their experiences? Let's see if anyone can relate their understanding from what they have already experienced.
Dali na lagi. Di mo na sakit? Di lagi. Promise. Di lagi. Pareha ba sa una? Gusto ko maingani mong tiil? Ha? Sige na. Sige na ba? Di ba ka dog? Alin ako sa nalimpyuhan. Ha? Maingani na yung tiil kung di mo palimpyuhan? Ganto ko. Diin. Sige ba? Maingani dyan na yung tiil. Hindi lagi ko alam. Di ba na sakit? Bitadan mo na. Sakit! Di lagi, promise. Para ba sa una, Bri? Palitan ng ice cream pag mahuman na. Bri. Kaya ito ka na. Ganahan nga ito ko ni Bri na. Biyan na ba ka ng pungkol ba? Kung nagpungkol mo na siya, huwag man niya di pa ko niyang samad.
Na, ganahan ka, yung classmate na itiil nga ikaw, usara ka buok.
Patay.
Nabi jud ko'y kauban, bray, nga naputol yung tail kay tungod kay nagnuka na yung samad kay wa siya nagpaayo. Nakuan jud, wa na siya ka-work gani ka.
Kita lang ko. Kita lang. Kita lang. Kita lang. Kita. Wala ko. Kita lang. Kita lang ko.
Diyan, mamalit ang ice cream karon kay gutom kaayo, may ice cream.
Maglakaw tara no?
Maglakaw ta karon kay murag uhaw kaayo dayon.
Di lagi ko. Ice cream. Daghan.
Ice cream, daghan nga ice cream.
Unsa man imong gusto?
Paliho kay aron dili makuan.
Pagbuha ka
Dili sige na. Dili lagi. Sige, soy. Soy. Sige na, soy. Soy. Oh, wala no. Wala no. Hayopon.
Wala.
Okay na. Okay na. Diba? Nainayan lang yun ha. Okay na. Sakit? Dali lang. Ato ka na. Wala na, di na sa langawon. Okay na siya.
Very good, Ms. Tolentino. I see you have done well in giving positive reinforcement to your patient. Now let's talk about negative reinforcement. Mr. Daiz?
So this is Cheska, my youngest sister. She's always full of energy and always loved to eat unhealthy food. One day, when I got home from school, I saw my sister binge eating with a lot of junk food.
Cheska, ang naliwat ito. Di ka mamati. Kikinaw ka din chicheria.
I realized that talking to my sister in an angry state would not solve the problem, but instead, I remembered that using negative reinforcement along with therapeutic communication can help me for her to realize about the ill effect of eating unhealthy food.
Kaya ano ka nalod nagkikinaw nito nga chicheria? Diba? Anya ka ng doktor, di ka magkikinaw ng chicheria. Kaya ba pwede ka na magka-UTI? Kaya ano ka magkikinaw niya na?
Kuya, kay marasa nga ni pagkinaon nini.
Kay hingan, anya ka ng doktor nga diri mag-ura-ura pagkinaw ng chicheria. Nakinundong ka ito nga nagka-UTI ka? Hindaw. Ano man tinatawag ginabatad ito nga nagka-UTI ka?
Nagkairantan na katumpero ka adlaw.
O tapos?
Masakit nga makuri umihi. Tapos, masakit ka rin naktiyan.
So ayan na, anong maging mapahimon? Para din magka-UTI balik ka.
Dili na kumakaw ni chicheria. Tapos, bisa na lang ng mga unhealthy foods.
Sige ha? So Cheska, yan na ha, di ka na makaw ng chicheria ha? Para di ka na magka-UTI. Kali kong istorya.
Pero nga naman makaunon.
Okay. Hindi mo good, kaya healthy niya. Tapos pwede take outin ka ng gatas. Sige ha?
Sige.
Tukang ko na din, lalabog ko na din. Sige.
Quiet the experience, Mr. Daiz. I see you have done well in your encounter. Now let's talk about systematic desensitization. Do you have something to share, Ms. Galvez?
I have this patient named Rufa, and Rufa has a dog phobia. That's how Rufa reacts every time she encounters a dogs. One time when I encountered with Rufa, I taught her some techniques.
Nurse, doon sa hero dito. Grabe kayo ang lukay kay kusog kaya pagod na lang sana maging grabe kayo itong hero kaya yung kusog kaya apit ko mapakan
Oh, nahadlok na pud kag iro no. Karon ato na walaon imong pagkahadlok sa iro, ganahan ka.
mawa pwede din mo.
Oh, pwede na ato lang hinay-hinayan. So first ako ipabuhat nimo kay diri lakaw ta diri lakaw. Karon ang ako ipabuhat kay mupiyong ka sa imong mata. Piyong daw be?
Unya, mag-imagine ka og lugar na unsay mo gusto na lugar.
Kanang beach,
Oo.
hindot kayo nga.
Oo, karon na ata sa beach, naligo ta og beach, unya naipadong na ero.
Ngano na may iro?
Mahadlo ka no, so dili na nimo imaginon ang ero, ang beach nga nindot imaginon. Unsay mo na feel karon?
May kalma na ko gamay.
Oo. So karon mata na ta.
In this technique, I let her concentrate in relaxing her muscles and trying to let her imagine on a beautiful beach with dogs.
Tutubuhaton, sunod na pod na 30 minutes. Okay ra nimo. Unsa man imo gibati karon?
Nakalma-kalma na ko gamay.
Oh, maayo. So karon ato na hinay-hinayan og overcome ang imo pagkahadlok sa ero. Karon, musta man imo gibati?
Arang-arang mo dyan siya na nawawa na akong kakulba.
Maayo. So karon ako ipakita nimo, okay ra?
Okay.
Okay, ato-atoon.
Asa man.
During this time, I let Rufa get close with the puppy, since puppies are less frightening. In that way, she will feel less anxious in getting close with a puppy. As the time passed by, as I was observing Rufa encountering with the dogs, she will practice deep breathing exercises to make her feel relaxed. There she goes with no sweating, no trouble breathing, and not even running away with it. Even though feeling somewhat frightened, however, she focuses on the fact that she is facing her fear.
Quite a good interaction with your client, Miss Galvez. I see that all of you students have already applied some behavioral therapy techniques even before this discussion. And I am more than satisfied to have had this meeting. Okay, that's all for today. Thank you for this interactive discussion. Goodbye.